I received an order for my patient IV needed for clavurin and IV Piggyback. It will be, I will be drawing up 560 milligrams and placing it in a 50 milliliter normal saline bag. I will draw up my medication label. I will remove this, the 50 milliliters. Maybe not wanting to be removed. There we go. That should help a lot. Yeah, it's just wanting to stay in there. Okay, so I have put all the information, which is patient name, the drug, which is clavurin. The amount on the order is 560 milligrams in 50 milliliters. My initials, the base solution, which is normal saline, 50 milliliters of normal saline, the date, the time, the flow rate, which I have calculated since the pharmacy has sent an already reconstituted medication of 500 milligrams per milliliter. The order is 560 milligrams, so that would get me 1.12 milliliters or 1.1 milliliters to draw up and add to my normal saline. So that would give me a total volume of 51.1 milliliters. So that would give me a flow rate of 68.1. If it's given over 45 minutes, it gives me a flow rate of 68.1 milliliters per hour, which gives me a drop factor of 1.1 milliliters per minute, which with the tubing at 10 drops per milliliter would give me 11 drops per minute that is needed. So I will put the label on my medication bag. Okay, so that's done. I am going to draw up the medication. I got myself a 3 milliliter syringe with and it's a 3 milliliter syringe with a 25 gauge needle, but it's also say, and it's 5/8 long, 5/8 inch long. So I will pull this out. My alcohol pad somewhere. I will take my alcohol pad and I will clean the top of my medication. I will, since I need to pull out 1.1 milliliters, I am going to pull 1.1 milliliters of air. So that's to here. Yep, that's to there. 1.1 milliliters. I am going to insert, add air, and then pull 1.1 milliliters of medication. Get rid of any of the bubbles. Pull that out. I will clean this little port here. Clean the port and insert. And add to this medication. I will dispose in my sharps container. Oh, it doesn't want to be in there. That's not good. I'll just leave it like that. Okay, dispose in my sharp container. I will take and invert the bag a few times. Make sure the medication is mixed. It's yellow now. Okay, that's done. It's inverted. I will take my Piggyback maybe tubing and get it out. Piggyback tubing out. I have this hook, which will hang, which I will hang the regular IV bag on. So let's pull it there. You can sort of see it now. The regular IV bag on. I will separate this tubing. My trash bag over there. I'm going to close this clamp. Okay. All right. So I'm going to take this blue top off. I'm going to take that off and I'm going to stick the bag. All right. I'm going to flip it and get some, fill this drip chamber so I can see some drops. There we go. Now I also want to prime this tube without losing medication. Priming. Okay. Tube is primed. And I've locked it back up. Now I will take my Piggyback line, put that up, put it up higher than my primary line. Maybe. Well, we have some good undone. There we go. So it's above my primary line. I am going to clean off this port with alcohol. Cleaned it off. I am going to remain sterile and clean. Push you in and lock the lure lock. I will have this at the unclamped. I'll probably have clamped this before I did everything. Unclamp it and unclamp this so it gets into the correct drop rate. And then let that go for medication. Make sure the patient is doing well. Check for any signs of infiltration around the catheter site, and make sure that the patient, I had come in and I'd verified with the patient that this was the right medication, why she was getting it, and now I've put her in a comfortable position, made sure that she had her call light near her, and done my correct documentation.